Good day, viewers. Welcome back once again to the YouTube channel of Nuanced Hospital. Last we had on our channel, we talked about mental health generally, where we had a consultant that gave us an overview on mental health, and he also made some contributions onto mental health disorders. Today, once again, we have him here in the studio, Dr. Uchendu UI. You're welcome, sir.
It's a pleasure to be here once again.
Thank you, sir. So he's going to shed more light on the causes he mentioned that we're going to be discussed subsequently. So we're going to focus on causative factors that have to do with mental health challenges or mental health disorders. Sir, over to you, sir.
Thank you. You're welcome. Yes. Last time, we gave a definition, simple definition about mental disorders, in which we say it's about abnormality of a psychological state of an individual that leads to changes in emotion, behavior, affects of the individual, then perception, thought, or cognition. And these changes are usually due to imbalance in neurotransmitters in the brain. And I want to emphasize this last part of this definition. Usually due to imbalance in neurotransmitters in the brain. We'll be discussing more about these particular statements when we start talking about management and treatment of people with mental disorders. Then talking about causative factors, why is it necessary that we should actually talk more about causative factors? It is quite important because there are a lot of, paucity of knowledge and misunderstanding or myths concerning mental health and what causes mental health disorders. One, in discussing mental health or causative factors in relation to mental health disorders, we can look at it in various ways. One, we can look at the biological causes. We could look at what we call psychological causes or social causes. But I personally try to divide them into two: biological and psychosocial causes. And when we talk about biological causes, we are talking about those causative factors that is related to physical or biological things, which can be obvious to everyone. One, at top of that biological causative factors, we first of all mention genetics. Genetics or hereditary has an important place in mental health challenges, has an important place in mental health disorder. But not all mental health disorders are inherited. I want to emphasize that. Not everyone who probably have a challenge mentally that would be said that inherited it from any of the parents. So mental health disorders has other things that can lead to it, whether someone has any member of the family who had suffered from mental health problem before or not. Then, apart from genetics, what are other things that could be a causative factor? One, can talk about trauma to the brain. at any age in life, whether as a fetus in the mother's uterus, or during births, or after births, or while the baby is still a toddler, or even when somebody is already an adult, probably in road traffic accident. Trauma to the brain is one of the major causative factors that leads to mental disorders in people who probably have such incidents of a road traffic accident that affects the brain. The trauma might also be a domestic problem, could be due to anything, but as far as it affects the brain to such an extent that the brain tissue, the brain, it has such an impact, it might lead to certain types of mental disorders. Two, we can talk about infection. Infection could be of any type, from the viral to the bacterial, depending also on the age of the individual. Infection is a very, prominent causative factor. Probably, giving an example, like people who have retroviral infection, some of them, with time, could see that their mental health is being also affected. There are more things to talk about infection, but let's me just kind of list other biological factors that we need to know. And with time, in our subsequent discussions, we'll be able to take each one of them, in such a way that the viewers and our listeners will be able to have a good grasp of what we are saying. We will talk about substances. Is also a biological factor. Substances, or we call it psychoactive substances. These are substances or chemicals that affects the brain in one way or the other, and there are many of them. From common things that we are aware of, like alcohol, like stimulants like coffee, cocaine, India hemp, tramadol, pentazocine, petidine, amphetamine. There are so many of them, but these are called psychoactive substances because they have effect on the brain cells, and these could affect the way the neurons works, the way the neurotransmitters are released, and eventually can lead to one or the other type of mental disorders. Among the biological hormones, there are certain hormones that are naturally in our body. Sometimes excess of it or less of it could also lead to mental health challenges. An example is probably thyroid or thyroxine. Thyroxine is being produced by thyroid gland. Then when you have hypothyroidism, when there is no sufficient quantity or quality of these hormones, what happens is that this could lead to memory derangement, depression, inactivity, and so on. In hyperthyroidism, it could lead to hyperactivity, excessive weight loss, mania-like psychoactive behaviors. So hormonal changes could also, and we have also found this even among the female, what we call catamania, that when there are certain changes in female hormones, so hormones either when there is imbalance, either in excess or less than the normal, could affect someone's mental health. Then we can move on to things like nutrition, malnutrition could be also one of the causative factors, depending on the level of the inadequate nutrition the person is having. Then we talk about medical problems. Medical problems in cases of people who have stroke, people with chronic illnesses that can come down with things like depression, cases with people with diabetes. So, in summary, there are a lot of biological factors that affect, physical factors that affect how the neurotransmitters function and can lead to mental health challenges, abnormal behavior, or cognitive derangements. Then I talked also about the psychosocial, which many of us know. We can't list, list is inexhaustive. We talk about negative life events. Negative life event could be separation, divorce, loss of loved ones, loss of valuable property, failure in exams, rape, being a victim of kidnapping, being a victim of war, being a victim of social dehumanization, losing in an election, probably unjustly detained by the law enforcement, or unjustly sent to jail without ever committing a crime. So that any negative life event, okay, or probably even among the law enforcement agents that you send to the war front might have PTSD, post-traumatic stress disorder. So the causative factors are many. Then the last one I will mention is about stress, which most times many of us don't really take care or try to understand that stressful life event, either at work or in the offices or at home or during exam, intellectual stress or financial stress, some of these things could affect our mental health, how good or bad the mental health might be. So in discussing these issues, mental causative factors is not something we are going to probably finish in one session. There are so much, and subsequently we are going to take them one after the other so that our viewers will be able to have a good understanding, that immediately once see there is a change in the behavior in one way or the other, the first thing that should occur to us is to start finding out where the problem is coming from, not thinking that this must be a demonic or a spiritual problem, and then we fall prey in the hands of those who are there to deceive people. Then in rounding up on this particular topic, except if there are other questions that we need to answer, is that when we talk about causative factors, there are three important words I want our viewers to take note of. We have what we call predisposing factor, precipitating factor, and perpetuating factor. Predisposing factor are those things that make somebody vulnerable. Why is it that two people probably had the same challenge, or let's say a family lost the loved one, maybe the father, and one of the children got down with mental health challenge because of that loss. Why is it that the other ones were able to move on? That's where you start thinking about what might be the vulnerability. What made that person vulnerable? Why is probably other people going through the same financial crisis? Some will start thinking about committing suicide, but another person is moving on with his or her life, believing as if nothing has happened. We talk about vulnerability. Precipitating factors are those things, immediate event that happened prior to the time the person now probably start manifesting or showing the symptoms of mental illness. Then we talk about perpetuating factors. These are the factors that after diagnosis have been made and the treatment is commenced, there will be a need to realize what are the factors that should be taken care of so that this particular illness or challenge can be well managed. Thank you, and I hope you listen, and the little we have said will profit from there. If there are any questions, please, we want to hear from you.
Thank you very much, sir, for giving us a lot of information in just one session. Sir, you mentioned something about neurotransmitters in the brain. I'm sure our viewers want to know what exactly you mean when you say neurotransmitters in the brain.
Yeah, neurotransmitters are chemicals that are in the brain, and these chemicals actually, because brain actually function like electric system. Okay, so these neurotransmitters, they are the channel through which the brain conveys its information. For every action of an individual is being, the order is given from the brain, and these orders are carried by these neurotransmitters. They are chemicals, where we have dopamine, serotonin, epinephrine, norepinephrine. There are so many of them. They have channels the way they move. So when there are imbalance in some of these neurotransmitters, it now gives the brain a wrong information. Gives you a wrong information. Let's use an example for something like wrong information on perception. When a perception is for you to be able to see a table, this is a table. But when there is what is called maybe visual hallucination, which is abnormality in perception, you see a table, you can now say that this is not a table, that this is a goat. Because the neurotransmitters is trying to give a wrong information to the brain, not conveying the appropriate. And that's why in some cases, people, when they see somebody talking that way or behaving that way, they will think now, oh, this is a spiritual problem. And that will become a problem whereby if they are not well knowledgeable about the problem, they can go astray seeking for help where they will not be able to get any good help.
Thank you so much, sir. So it's safe to say that these causative factors you've mentioned can cause those imbalances you're talking about.
Yes, these causative factors leads, whether it is physical or not physical, those changes will lead to these imbalances in the brain that now will make the person manifest in such a way they do.
Thank you so much for the information, sir. I'm sure our viewers have gotten so much to think about. So when next we come on our channel, we'll be able to discuss those causative factors you have listed so far, one after the other. Thank you very much for tuning in. We hope to see you next time.